views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.
Good day. You are listening to Ability Radio. I am one of your hosts, Amelia Headley-Lamont of the Disability Rights Center of the Virgin Islands. And today we are joined by a very enthusiastic professional in our community, a pediatric dentist by the name of Dr. Sonia Taylor-Griffith. Good day, Dr. Griffin. Thanks for joining us.
Oh, thank you. Thank you for having me. I'm really honored to be here with you.
Well, we're going to dive in because I'll tell you what I've observed as a person who uses dental services here on the island. There are certain days, at least over in this island of St. Croix, where they devote a day to dental care for children, and the room is packed. And I was told by the staff that, there's a lot of children in need of dental care. What has been your observation in your practice?
I can agree. I have a very busy practice here on St. Thomas. I was just thinking about it. I've been in practice here for over 20 years, almost 24 years. And so I have been able to really get a good feel of the pulse of our community. I also practice one day a week, well, more like twice a month, on St. Croix at the Frederickstead Healthcare Clinic.
Mm-hmm.
And I see patients there as well. So I definitely agree. We have, steady population of children. And what I'm seeing more and more of is our children with special needs. And again, the whole gamut, we see them.
What kind of dental issues or problems have you observed over the years, whether it's gotten better, worse? What are your overall observations?
My overall observation is that we do have a very high rate of dental decay here in the territory.
Mm-hmm.
That's definitely something that, concerns us all. For me, what I notice is one of the biggest contributor is our diet. We eat a lot of processed foods in the territory. And unfortunately, a lot of our processed foods have a high rate of sugars.
Mm-hmm.
And of course, that is a big contributing factor to the development of dental disease. The other challenge that we see is getting the children into care, sooner than waiting, for it to become a bigger issue.
Mm-hmm.
And then usually by that time, unfortunately for many kids, it means that I can't save the teeth,
Wow. Mm-hmm.
So getting the word out that dental care is important and getting the kids into care is very important. The other issue that I have seen over the years is just getting children to be consistent with brushing, not once a day or when the mood strikes them, but, in the morning and in the evening. In an ideal world, I would love them to have a noontime brush, but I live in the real world. So if I can get them to brush at least in the morning and in the evening, that would be really a game changer. And of course, getting them into care as early as possible. The American Academy of Pediatric Dentists recommends that we start seeing our children as early as when they get their first tooth.
Wow.
Instead of waiting. Yeah, because what we have seen over time is that our children have been developing decay very, very early. Even, the teeth have barely erupted and we're seeing decay. So the academy has, when I was in dental school, I think the age used to be like 4.
Right.
Then it was 3 and then it was 2. And now it's like, once you got a tooth, let's get them in.
Wow.
So because we're seeing so much decay at a very early age. So the academy has now changed its recommendation to say, once the first tooth come in, let's get the children in so we can start having conversations about the importance of dental care, speaking about diet, which I know the pediatricians do a really good job of. So I echo a lot of the sentiments that the pediatricians already share with the parents, but for them to actually see it, talking about bottle use, talking about habits, talking about when to expect the teeth to come in, eruptions, all of those things are important to prepare the parents for what next to expect with the development of their child.
Well, let's say you had a baby with a tooth that just came and that decay appears. I mean, how would you even treat that?
Well, if the tooth appeared it just depends on where the tooth is and if it is affecting nursing, if it's affecting the eating of the child. So again, depending on the situation and how the child clinically presents, then we would manage it at that time.
Now, you mentioned processed food, and typically when we think of sugar, right, when we think of processed food, what are some other items that may not suggest that you're eating sugar, but it is a processed food that can impact your teeth?
I know, unless, and this is what I tell parents, it's not 100% unless you pick it from a tree or dig it out of the ground yourself, and that's the hard reality.
Right.
So usually what I tell parents is moderation. Be cognizant of how much you give your child and how often. We're constantly grazing, and that's not really necessary for us to always be, quote unquote, shoveling food in our mouth all the time. Instead of giving the kid juice all the time, change it to water. I did, and if my kids are going to listen to this, they're going to laugh. I did a experiment with my kids. I said, no more juice in the house. I just stopped buying it. Okay. And nobody died. Actually, I lost a couple pounds. All our faces cleared up. And I haven't had an issue with decay within my household since I did that with my kids.
Wow.
And now that they're older and they're on their own in college, they're still drinking water, and this was just one experiment I did with the kids. So I tell parents, if you don't bring it into the house, then there won't be that temptation from either you or the child to consume that product.
Right.
So I just started with juice. Okay. When you really look at the juices that we buy, it's heavily processed. Okay. And so it has a higher sugar content. Like, I think the ones that come in those little packages, like the Capri Suns and that stuff, that's almost like sugar water.
Right.
And I know they put this disclaimer, oh, it's 100%. But like I tell parents, unless you pick it from the tree, it really isn't.
Right.
So moderating the amount that we give our kids, those fruit cups, that again, we think, oh, this is great, this is healthy, but it has so much sugar in the syrups that preserve the fruits that it's almost counterproductive. You know what I'm saying?
Right.
And so I usually tell parents, again, stay away from that. But the packaging is easy. It's easy to just grab it and put it in the kids' lunch kits and send them. And a lot of these kids will eat 3-4 of these things a day.
Right.
That's a lot of sugar.
That's a lot of sugar. All right.
So taking that out of the equation and said, instead of giving them that little fruit cup, give them the actual fruit, and then exchanging the juice for water. Okay. And the earlier you start children with certain habits, the better it is for them in the long run.
Right.
Again, just don't bring it into the house. And you don't have to start, cold turkey. Just choose one item. I'm not going to purchase X, and just allow that process to take place incrementally.
Right. Right.
Okay.
How do you,
So that's my take on the whole diet
yeah, the diet.
situation.
Yeah, no, that's excellent. I mean, it's certainly important to bear in mind and an easy thing to implement, once you are aware that there's a consequence, right?
Yes,
There's a
yes,
consequence.
yes,
I and I'm remembering, I'm sure you probably know or remember the details. There was an incident of a child in the States, I think in Maryland, who
yes,
died as a result of a
yes,
toothache, right? And the
yes,
decay
yes,
went to his brain.
yes. And that situation was multifactorial.
Mm-hmm.
It spoke to also access to care,
Right,
which is a challenge.
right,
The parent, and I'm trying to remember the details of the case, but there were some medical issues as well. But, you know, the challenge that we face is who can really afford it?
right.
And depending on the amount of decay that the child has and the treatment that is required, if it's extensive treatment and the parent or the child is either uninsured or underinsured, that means they may have challenges getting the care that they need.
Right.
So the mayor may very well know, yes, I need to take care of the situation, but I can't afford it
Right.
and depending on which state they're in and what the rules for Medicaid, Medicare, etc. are for CHIP, etc. for that state, they may not qualify or if they are qualified, there may be only a few providers that accept the program because it pays so little,
Right.
you know?
Right. And that's, as you indicated, a barrier for a variety of reasons, right?
Mhm.
Lack of federal, programs that provide dental care in a very, reasonable way, quite honestly.
Right.
What kind of insurance plans, for example, your practice accepts?
We pretty much accept most insurance plans. We are in network with Cigna and Elan. And for the other programs, for most of them, can't remember them all off the top of my head,
Mm-hmm.
we accept assignment of benefits, meaning we accept what the insurance pays and whatever is the difference that they didn't pay, the parent would be responsible for.
Okay. All right. What about our local Medicaid program?
Yes, I am actually a part of that. And the way that works within the territory, just to give you some background,
Mm-hmm.
Medicaid in the States, you, as a provider, you would sign up for it. And as a recipient, you would sign up and then you would go to, your provider who is a part of the program, present your card, they verify it, and you go ahead and get care.
Mm-hmm.
However, here in the territory, it is not set up in the same way. Before a patient can be seen by a provider, a participating provider, they have to go to one of our government clinics. And in this case, one of our FQHCs. If when they are seen by the dentist in the FQHC, if that provider cannot provide the care that the patient needs, then they would then refer the patient out to the provider. So you
Okay.
can't essentially walk into my office, present your Medicaid card and say, here I am for care. You first have to go, in this case, if you're on St. Thomas, to the St. Thomas East End Clinic
Mm-hmm.
to be seen by the provider there. If they say, okay, this is a case that we can't handle within the clinic setting there, then we will refer that patient out to, in this case, if it's a child, Dr. Griffith.
Okay.
And then we would then be, alerted that, this patient needs to be seen. They would come with a referral. We would then see the child, see what needs to be done, then send the information back to the Medicaid office to say, okay, Mary Jane showed up for appointment. This is what we need to be done. They would then review it and then provide another referral or authorization to say, okay, yes, Dr. Griffith, we see that Mary Jo needs this treatment, and yes, you can go ahead and do it. And that's how the process works here.
Okay. Now you mentioned quite a few letters here. FQHC.
Yes.
That's what it sounds. And that's the St.
Yes.
Thomas East End Clinic in St.
Clinic.
Thomas,
Oh,
right?
and the Frederickstead Healthcare Center on St. Croix.
Okay.
Those are our federally qualified healthcare centers
Got it.
within the territory.
And a parent would go there first if they are Medicaid
Right.
eligible. Okay. No,
Correct.
that's a very
Correct.
good way of explaining things. I mean, how do you adapt your approach to accommodate, let's say, if you have a child who has a disability of whatever,
Right.
variation during dental procedures? How do you work that in? And any person who's scared to
Right.
death of coming to see a
Right. So
dentist.
depending on the child, depending on the age, depending on the disability. So for example, if it's one of my patients that are in wheelchair, just to give you an idea,
Mhm.
my office is storefront in Havenside. So there is a handicap parking space literally right in front of my office.
Mhm.
So my patients who are in the wheelchairs would essentially park there and they would get wheeled into the office. We have special operatory that is a little bit wider that the parents can essentially wheel the children in and then transfer them to the chair. If it's a child who is below, say 2 years old,
Mhm.
and she is on the autism spectrum,
Mhm.
and this is her first time, we would have I have what we call quote unquote, and I say quote unquote because it doesn't always work, 2 quiet rooms
Mhm.
in the back where we would take those children and we would, have the parents sit with the child and we would work with the kids in the quiet room. For some of our older children, depending on where they are on the spectrum or their disability, sometimes I may schedule them at the end of the day
Mhm.
where I get everybody out and it's kind of like that is their time
Mhm.
because sometimes they may require more time from me to work with them initially. And then, eventually we can quote unquote work them into the regular patient schedule. So it really depends on the child and what their physical challenge is. And we just adapt accordingly. I have some, families who, well, not some families, many families, when they come the first time, they're like, Doc, I don't know if you're going to get to do it. I'm like, don't worry, we'll get it. And, I preface the appointment by saying, I'm going to let you know now it is going to be really loud, but we're going to get through this because I do this every day, all day. So it's not an issue for me, but I just need to know that even if it is a little bit unsettling for you, you're going to be committed to bringing your child every 6 months, essentially for the rest of their life to me, because it takes time for them to adjust to this process of I'm coming to a dentist. I have to sit in the chair. I have to, do all of these things. But once we get them in care, the parents are like, oh, wow, I didn't know it was going to be like this. Oh my gosh. I don't know how you manage this. And I'm like, this is what I do, So it's just making sure that we're consistent with the care that we provide for the children and that the parents are committed once they bring the children to, bringing them every 6 months. And if we need to do care, again, depending on the child, we will adjust accordingly.
Well, you made a point about having a sensory friendly environment. So if a child is just very agitated by noise,
Yes. Yes.
what do you do to mitigate that? I mean, because
Well,
the drill makes noise.
Yeah, exactly.
The
So
suction makes noise.
depending on where they are, I will let the parent know, okay, it's gonna get crazy now. Just bear with me. And, because we already know ahead of time, certain things are just going to stimulate them. But we do it really quickly and then we stop. If the child needs advanced care and their sensory sensibilities are high, I may opt to do a sedation appointment. And that's where I bring in an anesthesiologist and we essentially sedate the child to do whatever the necessary treatment is. And we do it quite a bit. So that we definitely offer. Again, if I've been working with the child for a long time, sometimes just giving them nitrous oxide gas is enough to calm them down. I can think of one child in particular. He loves nitrous. I mean, he wants it for everything. He's like, I want the special note. I'm like, well, honey, you don't know. I want it because it is so calming. But he didn't start off that way. We worked with him every 6 months. And when he got to the point where he did need dental, advanced dental care, I was able to offer nitrous, and that's all he needed. So it just depends on the child, what their needs are. And then, we make the adjustments accordingly. Now, there are some children, I will concede, if they have a special needs and added to that additional medical challenges, I don't do them in the office. Those I tend to refer to a children's hospital because they have the additional medical support to take care of the child in the event there's an emergency. They take care of them in that setting. And that's very common within our specialty to refer to a children's hospital for our children who not only have, special needs in the terms of, ambulatory and that sort of thing, but if they have additional medical issues that make it even more serious in terms of how we treat them.
Okay, give me an example because I'm not sure,
If it's a child that has additional cardiac issues, if they have GI issues, if they have respiratory issues, along with, say, if they're autistic, I would not treat that child within, my setting at all.
Right.
Those children, I definitely would refer them to the children's hospital because they have the additional medical support to take care of that child.
Okay. Are there any adaptive tools or techniques that you recommend for patients with limited motor skills to help with the brushing and the flossing?
Brushing. Okay. So there, again, we have gotten really creative, as it were, within this world. And for some patients, again, depending on their sensory levels, there's some motorized brushes that actually work really well with our children with special needs. And those children, I recommend it to the parents, and, it has worked really well for them. I think one of the major challenges that I find is, again, depending on the severity of their disability and what the home setting is, sometimes it's just that really challenging to get into their mouth, even for me, And so some of those children, I would say to the parent, instead of bringing them every 6 months, let's see you every 3 months, because I know you can't get into their mouth. Okay. If it's a parent who is the actual grandparent of the child and the child is a little older, so they're a little bit stronger, getting them to brush is really going to be challenging. Regardless if we do cartwheels for that kid, it's just not going to happen in the way that I would like them to happen. So I say, you know what, let's get them in every 3 months. And essentially, I quote unquote clean up after them, the best way we can. So again, I know I'm sounding like a broken record, but it really just depends on the child. It depends on the home situation, and it depends on what their challenge is and, where they are with that.
Okay. Well, we have
one thing I want to say though is those children who are getting supportive care in terms of occupational therapy, speech therapy, all of those cases, those children, from my experience, I find really progressed better over time with brushing and just overall dental hygiene and just even managing the dental visit. I find that they really do well over time. So I impress on the parents to keep them in, make sure you make your appointments, make sure you stay up with all of that, because I can really tell if they are being consistent.
And you're saying then with occupational therapy or speech therapy,
Yes.
it really makes a difference.
It makes a huge difference.
Interesting.
Huge difference. Even just getting them to understand, I need you to sit down, because they've been, doing that with their therapist. When they come to me, yes, I know to sit down eventually and that sort of thing.
We're going to have to cut this off. This has been very interesting, and I hope we can do this at some point again soon.
Definitely. Most definitely.
Our guest
and
today,
thank you for having me.
Thank you
for having me.
Our guest today was Dr. Sonia Taylor-Griffith, pediatric dentist who practices in the island of St. Thomas and St. Croix with the Frederiksted Health Center. Thank you so much for listening. Have a great day. Bye-bye.
The views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.